Hello everyone, this is Mr. Matus and I'm here today to discuss with you the pathophysiology of diabetes mellitus. Diabetes mellitus is one of the most common chronic diseases that we have, and also one of the most common questions that you will be encountering in the NCLEX. But for you to be able to answer the questions in the NCLEX, it is really very important for you to understand the pathophysiology of diabetes. So I'm here today to discuss with you the functions of insulin and also the specific processes that lead to the development of diabetes mellitus. So let's discuss this topic. So it's very important first to review the functions of insulin in the body in order to understand the pathophysiology of diabetes mellitus. So first, it's important to know what are the functions of insulin in the body. So you have the function of insulin in the body is to transport the glucose into the body cells. So without insulin, it will be impossible for glucose to enter the body cells, and the body cells will be in a state of starvation. Number two, the function of insulin also is to store glucose in the form of glycogen. So if the insulin promotes the storage of glucose as glycogen, that helps in decreasing the blood sugar level. Another function of insulin in the body is to stop the breakdown of glycogen back to glucose, a process known as glycolysis. So if insulin stops the breakdown of glycogen back to glucose, then definitely it also leads into a decrease in the blood sugar. So this is an illustration of the cells of the body, the bloodstream, and the kidney. And these are important illustrations for me to explain to you the pathophysiology of diabetes mellitus. So the green circles that you can see here, the small ones, let's pretend that they are your glucose. So what happens in diabetes mellitus is the lack of insulin, and with the absence of insulin, what happens is that your glucose cannot enter the cells. So when glucose cannot enter the cells, what happens is that your cells are in a state of starvation. They cannot use glucose as a form of energy. So you always have to remember that patients with diabetes, because of the lack of insulin, they are in a state of starvation. So with the glucose in the blood vessel and able to enter the cell, what's going to happen is that you're going to have hyperglycemia. So with hyperglycemia, the effect of that is an increase in the osmotic pressure in the blood. With increased osmotic pressure, we all know that increase in the osmotic pressure leads into a magnetic attraction of fluid from the surrounding areas, so that the fluid from the cell will transfer into the vascular space or into the blood vessel. So with this process of fluid transferring into the blood vessel, the cells of the body develops a state of dehydration. And that's why it's very common for patients having diabetes mellitus to experience excessive thirst. So with increased osmotic pressure, what happens is that the patient develops glycosuria. Glycosuria is when there is a glucose in the urine, and glucose is present in the urine because of the hyperglycemia. So if the level of the blood sugar is already 180 milligrams per deciliter, usually that leads to glycosuria. So what I would like you to remember is that your glycosuria is not one of the best indicators of early stages of diabetes, because by the time that you see the glucose in the urine, the blood sugar is already very high. So take note that the first P of diabetes is going to be your polyphagia, which indicates that the patient is going to have excessive hunger. And the reason for that is because the glucose here is unable to enter the cells, and the cells of the body are in a state of starvation. Now, with the fluid shifting that happens over here and then the glycosuria, of course, with increased osmotic pressure, the water, or the fluid will also go with that, and that leads to the patient developing your polyuria. So polyuria is an increase in urination, and that's the second P in your diabetes mellitus. And lastly, because of the polyuria, the patient will develop polydipsia, which is excessive thirst because of the dehydration. So what I would like you to remember is that patients with diabetes are in a state of starvation, and at the same time they are in a state of dehydration. And that's why one of the most common interventions if the patient has severe hyperglycemia is giving them insulin, and at the same time is to really replace the fluids of the patient in the body. Now with the cells in a state of starvation here, so the body thinks that it's hungry because it's missing the glucose. So what the body will do now is to start converting your fats and proteins into glucose in a process known as gluconeogenesis. So with gluconeogenesis, which is the breakdown of fats and proteins into glucose, that leads into the patient's weight loss. And lastly, the development of ketosis, or the production of ketones. You should remember that with the breakdown of fats, a byproduct of that will be ketones. And ketones are acid in nature. And when you have increased accumulation of ketones in the blood, that leads to ketosis. And if it's really very high level of ketones in the blood, like in patients with type 1 diabetes, they develop a complication known as diabetic ketoacidosis, because these acids cause CNS depression, even to the point of the patient developing diabetic coma. So generally, this is the picture of the patient having diabetes mellitus, the whole pathophysiology. So I hope that I was able to explain to you this pathophysiology as clearly as possible. So my NCLEX tips for everyone will be, especially for those taking the NCLEX examination, is for you to remember the 3-letter P's of diabetes. And it's not enough just to remember the 3 P's. You have to really understand why the 3 P's develop, and also to really understand also what's the reason for breaking down the fats and proteins into glucose, and what's the complication of that. So this is a very quick explanation of the diabetes mellitus pathophysiology. So I hope that when you take your NCLEX, you will be able to use these concepts in answering the questions. So if you have any questions, please don't forget to post your comments below, or also please click like, share my presentation, or subscribe to my channel. And you can also visit my website at www.matusnursingreview.com. Thank you very much, everyone.